As frequent viewers know, a regular feature of our program is a sort of show and tell, where guests bring in something, some item, could be a book, a photograph, who knows what. But it's important to them in some way, symbolic of who they are and what they're about. Dr. Park, what have you brought with you?
So this is a belt. It belonged to my late father. And I remember this is the belt that he wore when we would go camping. So this was a kind of a childhood memory for me. And so this belt is probably about 40 years old. It's from LL Bean, but the cool feature about this belt is it has an inside zipper. And so my dad would always keep a $100 bill inside the zipper. And so the reason for that was if you ever had an emergency and you ran out of cash or something like that, you could rely on the $100 bill inside your zipper to get you out of trouble. So for me, it symbolizes family. It symbolizes my childhood memories of going camping, and then also this preparedness, always being ready for emergencies or things like that. And so it has a lot of sentimental value to me. So,
Dr. Shlykov, what have you got?
Yeah, so there have been so many people that have impacted my life, both personally and professionally. And one of those people was my grandfather on my American side, and this is his coffee cup that I was given by my grandma after he passed away. He was an obstetrician gynecologist, and he practiced in a rural part of California, and he actually kind of oversaw the birth of a lot of the population there, and he was just highly esteemed in the community. And he was also somebody that, kind of brought himself up sort of by his bootstraps. They had a family business, but he sort of gave all that up and was sort of pushed out of the family a little bit to pursue medicine, actually. That was his passion, and he ended up really helping so many people in the end. And so, I just think it's a cool cup. It's funny, it's quirky, it says New Maroon on it. And so, throughout all my moves from the West Coast to the Midwest to the East Coast, I've always kept it with me just as a reminder. And he's, somebody that really, I think lit the spark for medicine for me.
In my experience speaking with surgeons, when I've asked them where they're most comfortable, the response I've gotten most often is the OR. Would you agree? Is that where you're most comfortable?
I think I would definitely agree with that. The driving force for me through medical school was to always kind of find my place within medicine. And I think, again, my experiences in medicine shaped me to going into orthopedics. My experiences in spine throughout residency that shaped me then going into fellowship for spine surgery and then doing what I do now. And so for us, the operating room or the operating theater is kind of our office. And so that's where I feel most comfortable doing what I do. And we here at Mercy have teams. And so I've been here for nearly almost 10 years now. And so over the last several years, I've really been kind of cohesive in working with the same group of providers, anesthesiologists, nurses, scrub techs. And so we have very much a family type environment in the operating room. And so it's just kind of where I do my work, so to speak. And so again, I love being in the operating room.
I think I would agree as well. I would say the operating room, I'm confident in my training and my skills, but I also have a healthy respect for each surgery and the risks that come with each surgery. And also just a respect for the patient and trusting me to take care of them. In college, I drove a shuttle for work. And so I drove students around a big 40-foot bus. I got a commercial license. And what they told us was, the first 6 months, you're doing great. And then, once you become comfortable, that's when problems happen. And so I think some discomfort in any setting is good because it pushes you to become better. And I think, the operating room is where you more directly, what you do in the operating room technically is, there's a little bit more of a direct correlation with how things move forward. But outside the office, sometimes there are obviously some challenges with guiding patients through their recovery, and sometimes you have a little bit less control versus in the operating room in how they recover and what their symptoms are from day to day. So.
Now, what's your respective takes on the direction of modern medicine, for example, the use of telehealth, which has sort of exploded during the pandemic particularly, and now we talk about artificial intelligence in medical research and virtual reality and so forth. Do you think these are positive improvements or negative or somewhere in between? How do you feel about that?
Yeah, I think I can speak a lot about the telehealth side of things because a lot of that kind of boomed throughout COVID. And so having a busy practicing spine provider during that time and then seeing how really COVID shut everything down for 4 weeks where I didn't even come to work. And so that was the first time I actually used telehealth. And I remember doing some patient visits and follow-ups of post-operative patients at home through telehealth. And I was really happy with the interaction that it provided. It was a good tool to use during this dark time to provide a connection with patients and people. And then how it's evolved for me now is that I have a lot of patients who actually don't live that close to Baltimore. And so people sometimes travel 3 hours to come see me from Delaware, West Virginia, Southern Maryland can be up to 2 hours away. And I think for a lot of those folks, they sometimes if they're a post-operative patient and they're doing well and they have some questions, telehealth has been very helpful. For other patients, they just want to have that first interaction with a provider, and telehealth provides that means of doing so without having for them having to block out an entire day for a single doctor's visit. So it's something that has remained, and it's something I think has been quite helpful.
You know, in terms of kind of your question about artificial intelligence, you know, I think technology in general is evolving and improving, and overall, I think it's you know, it's a good thing. There's artificial intelligence being used in spine surgery to help determine what the best alignment for the spine is after surgery. It can pick up things on X-rays, so it's definitely good. There's obviously what we see on the news where there's artificial intelligence that will generate questions and responses. I've actually had patients come in and say, "Hey, I typed in I asked, what question should I ask you?" And they ask questions based on what artificial intelligence. So there's good, you know, pros and cons to it, but it's definitely, it seems like it's the move towards the future. So.
You both mentioned you're pretty comfortable in the OR, but you don't spend all your time there. Like to do some other things. Dr. Park, I see you have an interest in tennis, fishing, camping, golfing, all outdoor activities. What's the allure of the great outdoors? So I think I can guess why, but you go right ahead.
Again, I guess my show and tell object kind of alludes to the fact that that's been something that I've done since I was a kid, and I have really fond memories of that. I'll be honest, that's something that has kind of dwindled in my life as I've gotten busier with my career and family and things like that. But something that I want to definitely integrate my kids into as they're growing up. A bucket list item for me was always to go fishing in Alaska, and I'm actually doing that next week. So I'm going to be going out to Alaska for a week to do some salmon and halibut fishing in some pretty remote parts of Alaska, and hopefully we'll bring back a lot of fish. But again, I'm excited to do that. There's two of my childhood friends that I used to go camping with during those times when my dad would wear this belt who are joining me, and a few of these friends I haven't seen in over a decade. So I'm very, very excited for that and looking forward to that.
Fantastic. Dr. Shlykov, you practiced at one point at Barnes Jewish Hospital in St. Louis. And while you were there, you were a member of the Fellow Diversity Initiative. Now, this was a group focusing on fostering and retaining diversity at Barnes Jewish Hospital. Now, that's interesting to me because we hear a lot today about the importance of diversity, equity, trying to integrate these things in our day-to-day lives and in our work. So what did that entail, and why is diversity important to you, in your opinion?
Yeah, so the resident and fellow diversity initiative, it's something that I applied for and I was accepted into. And so it brought residents and fellows from different parts of the hospital, different departments. And our goal was to foster diversity and improve it within the hospital system. And so we went back to our respective departments and through our recruiting of residents on residency selection committees and reaching out to medical students that are underrepresented in the orthopedic field, we were able to improve diversity. And as a group as a whole, just when we came all together, one of our initiatives was to identify patients with sickle cell disease, as oftentimes when they go to the emergency room, their pain is undertreated. And so we're able to coordinate with the cancer center, the hematologists, and also the emergency room to identify these patients and alert them that these patients require maybe more pain control than other people. That way they're treated adequately. And, I think in terms of diversity, I think that's the beauty of America, that there's so much diversity and people's knowledge, their experiences, their different viewpoints. They challenge you, they foster creativity, and we know that organizations that are more diverse function better and have better performance. So it's something that is very important.
Now, I also see you were vice president for a group with an intriguing name, Wolverines for Life. Tell us about that.
Yep. So I went to medical school at the University of Michigan, and go blue. and so when you start medical school, you have these student organization fairs, and you're kind of inundated with all these student organizations where you have to pick which ones you want to participate in, because you only have a certain amount of time. And so this was an organization that really caught my interest. It's an organization dedicated to promoting blood donations and signing people up to be organ donors. And so in my role, I worked with the Red Cross, the Gift of Life, and the medical school to kind of coordinate blood donation drives around the school. And also kind of one of my, I think, most proud sort of achievements is having a blood drive at the Big House, which is the biggest college stadium in the US. And so we brought people in, and there were about 600 people that donated blood and signed up to be organ donors. And they were able to check out the amazing University of Michigan field during it. And even my medical school class, we were able to sign up most people to be organ donors. So it was definitely a rewarding experience, and I think it really impacted a lot of people.
Drs. Park and Shlykov, I'd like to thank you for joining us on the Medoscopy set today, and hopefully our viewers enjoy the opportunity to learn a little bit more about you, what you do, and maybe they learned a thing or two they can apply to their daily lives. And thank you for watching. On behalf of myself, our guests, the Mercy staff, and the Sisters of Mercy, we wish you good health and humor. And until we gather again, may the road rise up to meet you. So you stayed all the way through the credits. Congratulations. You're here for Wait, Doctor, I Forgot to Ask. This is where we briefly discuss the question each physician wishes their patients would ask, but don't, or the most unusual hand on the doorknob question posed by a patient at the end of their visit. Dr. Park, we'll start with you.
So I guess a thing that I deal with a lot, particularly in post-operative patients, is we get done with the surgery and then people are in the hospital. And sometimes they'll ask me questions about what kind of care they'll need after the surgery, and the surgery's already been done. And so I think one thing that'd be helpful to ask while we're in the office, discussing the surgery itself, recovery time, and getting back to work is, what can I expect when I go home? Or will I need a family member there? Will I need a friend there? And obviously, depending on the type or scope of the surgery, that answer will be different. There are certain surgeries that I do where I tell folks, yeah, I think you'll be fine just with a family member or a friend to just make sure you're fine overnight just because of the anesthesia that you had. There's other surgeries where I tell them, yeah, you'll probably need someone to help you for a better part of a week or two. And so, again, depending on what the surgery is and the patient age and their lifestyle, that answer can be different. But I think that'd be helpful to talk about in the office prior to everything being done, rather than in the hospital or over the phone call a day or two after the procedure's been done.
And I think it's also very important for patients to bring somebody with them to the visits, because another set of eyes and ears, somebody to take notes, to write down questions for the future, is really important.
No, that's a very good point, because obviously patients are coming in, maybe they're dealing with a lot of pain, maybe they're scared, they're intimidated by the situation. Unless you're having a baby, most people who come to a hospital don't want to be there. So, when you have to deal with that, it is a good idea, I think, to have someone else there, simply due to the fact that your brain can seize up. And that's the idea behind Wait Doctor, I forgot to ask, because it's like, I've waited all this time, I finally decided to make a doctor's appointment, I've come in, and it's over, and I'm in my car, and I'm driving home, and it's like, why didn't I ask this? And it all comes down to, and I think you gentlemen have made the point very well, of that communication with the patient, to putting them at their ease, and to relax them so that they're going to be more likely to open up and tell you these things. As one physician told me in this format, that I have patients seeing me on their third or fourth visit telling me things I needed to know on their first visit. So would you say that's pretty important? And any just final thoughts from you about what you try to do to put your patients at ease so they will open up and tell you these important things?
I think in that first visit, or in the first few minutes of that visit, just trying to get to know the patient, not just talking about why you're here, but what did you do? Are you retired now? What do you like to do in your retirement? And I think asking those questions not only kind of breaks the ice, but it also gives you an idea of what do they want to get back to, or the problem that they're coming to see you for here today, how is it impacting what they can't do anymore when they are retired and they want to be doing X, Y, and Z, whether it's vacationing, walking through the Vatican, and things like that. And again, I think Max had a great point that bringing a family member or a friend, another set of years, like you said, it does really help. And I think people processing what was talked about during that patient visit, because again, when that S word comes out, surgery, a lot of times a patient will go into a brain freeze, and it goes in one ear and out the other. And again, they go home, or they're on that drive home, they're like, oh, I needed to ask this, why didn't I ask that? And so I think that's a great point. So
Thank you, gentlemen.